Natalie with Nutrition by Natalie. Imagine a system in America, food culture, grocery stores, healthcare, that are set up to support you and your goals and your health and not work against you. Well, this is all possible with RFK Jr. in his new role as Secretary of Health and Human Services and his mission to revolutionize the big three: food, environment, and healthcare. Let's dive into 4 super cool potential upcoming policies. Number 1, cheaper, healthy foods. That can be through coupons, discounts, cash back for single ingredient and whole foods at the grocery store. Imagine going grocery shopping and it's cheaper to buy things like almonds and berries than it is to buy packaged chips and cookies and crackers. Or how about this? How about $5 back towards every $50 spent on produce? Okay, when we shift government subsidies from commodity crops like corn and soybean and sugar and wheat, and we shift those over to farmers that are growing vegetables, for instance, that are not those commodity crops, well, that means that those farmers now have an incentive to grow those crops. The outcome is a lower price for you at the grocery store. Now, commodity crops, these deplete the soil. They also deplete our body of the nutrients that we need, and yet those are the foods that are priced the lowest at the grocery store because of those government subsidies. Now, behavioral psychology will say that you are going to repeat the behaviors and choices that are incentivized or rewarded. So, well, when you think about it, we are incentivizing the wrong types of foods in our society and in our culture if we really care about the fact that 74% of us are overweight or obese. Okay, here's a real life example. Back when I was a corporate dietitian for Apple for about 10 years, one of the coolest benefits of working there was how they priced their food at the cafeteria. The cheapest meal that I could get at lunch was this huge ginormous salad from this glorious salad bar, and the salad was so big you could choose whatever protein you wanted, whatever toppings you wanted, whatever dressing you wanted, and it was so big I usually couldn't finish the whole salad in one sitting, yet it was $4.50. What line do you think was the longest at lunch? The salad bar line, of course. So, cheaper foods through RFK's policies, cheaper healthy foods, means you have less barrier to buying and eating those healthy foods. So this is a welcome change to policy. Now, no need to wait for this policy to come through in the future. I'm going to share some tips with you at the end of this video on how to cut your food budget and your food costs when you are trying to eat more of these single ingredient and whole foods from the grocery store. Number 2, food stamps become food boxes. Okay, right now there is $25 billion worth of fraud happening every year within the USDA's SNAP program, the Supplemental Nutrition Assistance Program. You heard me right, not million, but $1 billion in fraud. So what does this look like? Well, people can use their SNAP benefits, they can sell them for cash, or you can just misuse those benefits by going to the nearest gas station and buying chips and candy and soda and energy drinks. One of the big schemes that happens is food stamp benefits are stolen by criminals and then used by those fraudsters to buy bulk food products like pallets of Red Bull, and then they sell those to retailers for a big markup. Now, this information comes from a close USDA insider, and talk about fraud, waste, and abuse. Now, do I think food stamps and SNAP programs need to go away completely? No, but a big overhaul for sure needs to happen. Well, what could possibly replace that? Okay, so one of the best examples is Ivanka Trump's 2021 Farmers to Families Food Box program, where 75 million boxes of fresh food, we're talking milk, meat, fresh produce, was delivered 6 days worth of meals to community groups, faith-based organizations, and it was wildly successful. It met its intended goal of nourishing and helping feed vulnerable populations. So this is an excellent example of a program that the government could change, SNAP, into something like this with way less potential for fraud. Number 3, RFK Jr. is to be cleaning up the environment and our food supply thanks to bans on food additives, pesticides, and herbicides. Thank the Lord. Because there are 10,000 food additives that have made their way into our food supply in the last 100 years. And that's not to mention the 12,500 accidental chemicals that have made their way into the food supply. No wonder our physiology is freaking out and doesn't know how to thrive in this toxic soup. Okay, so goodbye to food additives like dough conditioners and food colors and just other artificial synthetic ingredients that are linked to lots of different chronic conditions: infertility, ADHD, obesity, chronic inflammation. With these bans, finally, companies selling food products in the US is gonna match the EU. I mean, that's not asking much, is it? Okay, so here's one example how these former cigarette, now mega food companies have been taking advantage of us. So here's an example of the same food product created by the same company, totally different ingredient list between the US and the EU. So really gonna be great to see those ingredients improved. Now, let's talk about glyphosate. This is the most prevalent pesticide in the world. It's on most of our fruits and our vegetables and our grains in the USA, along with 225 other pesticides. Interesting that Germany, where the big chemical giant Bayer is located and they own Monsanto, glyphosate is actually banned in Germany. Of course, not here. I wonder why. Now, you might be thinking, okay, this is like so out there, this isn't really impacting me, but listen to this. Research from 2023 UC Berkeley School of Public Health found that in over 400 kids that were tested, glyphosate levels were found and they were linked to liver inflammation, metabolic dysfunction, which is related to prediabetes that we're seeing in epidemic in children, obesity that we're seeing in children, and that's also impacting cancer risk, inflammatory disorders, diabetes risk, all kinds of chronic health conditions. Now, if you or your child are suffering from one of these conditions, stay tuned because the number 4 policy that I'm going to be talking about today is really going to give you some hope. Now, atrazine is an herbicide, also so heavily used in the United States, banned in lots of other countries. It's on 65% of our corn crops in the USA. You know, one of the things I've been really thinking about lately is when people just benefit so much from going carnivore or meat-based and they're dropping a lot of their plant intake, I really wonder if it has to do with all of a sudden they have this huge drop in exposure to these pesticides and food additives and herbicides. Number 4, diet and lifestyle prescriptions first from your healthcare provider and covered by insurance, not just this heavy focus on pharmaceuticals and medications. Okay, so to be fair, many doctors have their hands tied behind their back because they have all of these patients with lifestyle related chronic diseases that need lifestyle and diet interventions, and yet they were never educated or trained on how to deliver those or execute those plans with their patients. In fact, less than 8% of doctors have any meaningful nutrition training in their 4 or more years of medical school. So when doctors start to understand that food and stress and sleep and hydration and your environment and activity are really the root causes of inflammation and all of these chronic diseases, then we're gonna really start to see a big shift towards these types of treatments, especially when insurance is covering those. And so one of those examples is unlimited nutrition visits with a dietitian like myself. Now, right now, I do see some patients through insurance, and one of the best plans out there for my patients is Blue Cross Blue Shield of Texas. This typically means $0 copay for my patients, and they get unlimited visits per year for whatever health condition or goal that they have in mind. But out of all the available insurance plans across the nation, that doesn't equate to a whole big portion of the population. So look for more options like that. Also, look out for the ability to use FSA and HSA funds for things like gym memberships and fitness equipment, food box programs, non-prescription supplements, sauna therapy, which is such an amazing way to help the body detox and improve your health. You could also maybe use these funds for discounts on doctor-prescribed foods or diet interventions or behavioral health programs. One of the things you can do right now is go to truemed.com and you can start the process of using your FSA and HSA funds to apply towards these sort of services and options that I just mentioned by having a medical provider You work through them through TrueMed, but a medical provider will assess your current diagnoses and that kind of thing, and then provide a letter of medical necessity so that you can use those funds right now. Now, rather than waiting for RFK Jr. to get into office and do his thing, well, it's time for you to do your thing. The way you eat today, the choices you make today, your health is still in your hands. So here is what you can do today. Number one, you can go ahead and reduce food costs of healthy foods today by buying in season and on sale produce, buying meat in bulk, and you got a freezer, stock up that thing. Use that freezer to your advantage. And you can even buy, frozen produce more often than fresh produce. A lot of times that's actually more nutrient dense. It hasn't been rotting away in your veggie drawer in your refrigerator. All right, you can also, number two, reduce your exposure to food additives and herbicides and pesticides by choosing organic and locally grown food as much as possible, and swapping those commodity crop foods, things that are full of corn and wheat and sugar, for single ingredient and whole foods like fruits and vegetables, filling up half of your plate with that produce. That's also going to increase your nutrient intake, which helps your body detoxify all the toxins that are in our environment. And generally, if you're looking to improve your health and reduce inflammation and just plain old feel better, if you focus on meat and eggs and fruits and vegetables and beans and olive oil, and that is like the bulk of your diet, that works for most people in really improving their health. Number three, you can help your own body detoxify better through elimination, and that's done through poop and pee and sweat. Yes, get your exercise on, increase your fiber, increase your water. There are some specific foods that also help your body detoxify. One of those is seaweed. Lots of easy ways to get that in your diet. Sushi, delicious. Those salted and seasoned seaweed snacks. Yes, there's one that I recently found called, I think it's chili lime. So yummy. And then also there is a product on Amazon, it's called Pectosol. It is a citrus fiber. That is one that has been studied. It binds to heavy metals in your body. Fun fact, when you lose weight, your fat cells shrink. When fat cells shrink, they release toxins, because that's where your toxic material is stored, in your fat cells. So when you lose weight, that toxic material goes into your bloodstream, and you want to flush that out to feel better. And so you're going to do that through lots of hydration and getting your sweat on. Now, let's say you've heard all this and you're like, yep, I'm still worried about my exposure level. Okay, so check out detoxproject.org. I have no affiliation with them, but they do have two really great analyses that you can test for plasticizer exposure and pesticide exposure through either a hair analysis or this really cool silicone band test. All right, so you start working on your health today, and you are going to be well prepped for a boost to your health when RFK gets into office and the environment starts to change around you with his policies. See you next time. Bye.